Welcome to the medical news. In this edition of the medical news, we will talk about diabetes. According to the World Health Organization, currently about 347 million people have diabetes. And this number will be double in the next 10 years. Especially in the United States, over 25 million people are living with diabetes every day. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will share with us the information on diabetes. Please welcome Dr. Tran to the medical news.
Hello and welcome to our show today. And again, hello, Mrs.
Hello, Dr. Tran. First of all, would you please explain to our audience what diabetes is?
Diabetes is the chronic disease marked by the high levels of the sugars in the blood. The sugar in the blood is named glucose because most of the sugar we eat will break down into the bloodstream into a small simple particle of sugar called glucose. Any time that the glucose go beyond the normal limit, we call this is related to the disease called diabetes mellitus. To understand the diabetes, we need to understand how the body processes all kind of sugar or food. Remember, when we eat, anything really have sugar in there will be absorbed to the body. And in the body, there is one organ that specialized to deal with the sugar called pancreas. The pancreas will release the insulin and to help to move the glucose into different levels of the body to use it. Really, the insulin acting like a key to open every door to put the glucose inside because the body needs glucose to make the calorie or make the energy for the body to use it. The same time, the pancreas releases the glucagon, the opposite effect of the insulin. The insulin helps to reduce the sugar, but the glucagon will increase the glucose in the blood by mobilize the sugar in the liver to release to the bloodstream. In case of the person cannot eat or they really skip the meals or they're hungry for a few days, then the body usually have to use the glucagon to do that. So the pancreas have two functions. Number one is the insulin. Number two is the glucagon. Now beside that, we have the third one is very important, also it's called incretin. Incretin is the chemical released by the stomach and intestine when they contact with the food. The incretin really have the function to increase the release of insulin from the pancreas, so therefore very important. But unfortunately, the secretin will be inactivated quickly by the enzyme called DPP4. DPP4 really inactivates the incretin right away. Therefore, the incretin cannot really prolong their function to stimulate the pancreas to increase the insulin. When the scientists know that, they know how to produce some chemical similar to incretin to improve the treatment of the diabetes, and also they can block the DPP4, they call it DPP4 inhibitor, in order to improve the incretin to increase the amount of insulin. Very complex, but hopefully you understand. Right now, beside the insulin, we have the new group of medication called incretin.
So what happens when a person has diabetes?
When the sugars increase, the body cannot really tolerate that, and we have the symptom related to the high sugars in the blood.
So how many types of diabetes?
Right now we have only 3 types. Number one is diabetes is type 1. They call it insulin dependence. Usually happen in the young group people and in childhood or teenager. They really depend completely on insulin because the pancreas cannot really produce any insulin. The cause is very still unclear, but the people thinking it could be run in the family or could be the virus and causing damage to the pancreas. And lastly, they think the person may have some kind of autoimmune process going on. Autoimmune means the body fight against their own body. So when they do that, they can cause some damage to the pancreas. Therefore, the type 1, the person cannot produce insulin. The second group we call diabetes type 2, called non-insulin dependent or adult onset, because mostly happen in the people really in old age and over 40 years old, and the body is still making insulin, but the insulin is really not enough for the body to use, or the problem with insulin is this group become resistant mean the insulin cannot really open the door on different organ to introduce the glucose inside. So therefore, the glucose keep increasing. So we call insulin resistant, meaning there is insulin available, but the body cannot use it because the cell resists to get the glucose get into their cell. The third group is the diabetes during pregnancy. Very rare, about 3 out of 100 pregnant women may develop diabetes. But the good thing is after the delivery, the blood sugar may come back normally, but they have the increased risk of developing diabetes in the future, later in their life.
How can a patient recognize when he or she has high blood sugar?
Well, the symptom related to blood sugar is very complex and really is changing a lot. In the old day, we're thinking the people really eat a lot, drinking a lot, and urinate a lot means it's diabetes. But nowadays, for the early stage of diabetes, people maybe just feel tired, or they feel have some blur visions, or feel like sleepy after eating big meal. They have dry skin and thirsty all the time. And especially, they're still able to eat well, sleep well, but they're losing weight. So that's a concern. And especially when they have some kind of infection in the skin, infection in the feet, but it's tough for them to get rid of the infection. So that's also concerned about the diabetes.
How do you make a diagnosis of diabetes?
The diagnosis is so simple because right now with all the technology, simple blood tests, we can identify them, or we can use a blood sugar kit, and the person can check their own. But very important is we need to know if the blood sugar in fasting phase, has been when a patient really fasting for about 6 or 8 hours, if the blood sugar is really above 126, that means very likely people have the diabetes. But if at about 126, that's called pre-diabetic, that means it's not sure the patient had diabetes, but they may have the likelihood of developing diabetes. Now the second thing is usually in old days we use glucose tolerance test. That means people in empty stomach, we check the blood sugar and then give the person a bottle of sugar to drink, about 50 grams of carbohydrate, and measure the blood sugar after 3 hours, they call it glucose tolerance test. If after 3 hours the blood sugar over 200 milligrams per dl, then very likely this person have diabetes. Now recently we use the special test called hemoglobin A1C. Hemoglobin A1C is special hemoglobin in the blood that carry glucose. The hemoglobin A1C will give us some idea what the blood sugar look like for the last 3 months. If the normal people, the hemoglobin A1C will be less than 5.6, the higher the more sugar in the blood. For instance, if the hemoglobin A1C is 7 and the average blood sugar could be over 180 in the last 3 months. The hemoglobin A1C used for diagnosis of diabetes, but also to follow the patient during treatment, because they need to monitor that to make sure the hemoglobin A1C have to go down to close to the normal level. If it's still high, the physician had to increase the medication, or the patient had to be on more strict diet, or they have to move to a different kind of treatment.
Dr. Tran, would you please talk about the pre-diabetes condition, and can this condition be reversed?
The pre-diabetes means is the patient really doesn't have much symptom, but the blood tests show they have the blood sugar fasting about 120 to 126. At the borderline level. This is the sign that the pancreas is really not function well, and they need to be on diet and need to be on exercise. The good thing is it could be reversible if they're on strict diet and they know how to do exercise every day.
Dr. Tran, would you please talk about the risk factor that leading to diabetes, who will be easily to get this diabetes?
The group of people really have a high risk of diabetes is the group of having really obese and not enough exercise, usually a bit older, 45 years old, already have hypertension is very important, and the family member, unless the mother, brother, sister have diabetes. So always obese, family histories, and not enough exercise, the risk of having diabetes.
So what are the complications of diabetes?
The complication is very important. Everybody with diabetes needs to understand clearly, because the high sugar in the blood will cause damage to the cell, damage to the nerve, and causing a lot of complication. For the vessel, they can cause blockage and cause stroke. And for the eye, they cause damage of the back of the eye called retina and causing blindness or blurred vision. And also they can cause blockage of artery of the heart, causing heart attack. They can cause kidney failure, because it's very important, because even though with strict diet, even though with the medication, the patient still move forward to getting renal failure because of the diabetes. For long run, it's still causing damage to the kidney. Neuropathy is very important because people may losing their sensation. They feel numb of the feet or hands, and they don't feel the sensation normally. Therefore, they need to be protected if they develop these complications. And lastly, they can get all kind of infection from bacterial, from viral, and from yeast infection. So therefore, it need to be so careful, because the diabetic patient easy to get the infection, and the defense system is really much lower than normal people.
Dr. Tran, what are the important points, important things that a patient needs to remember during the treatment process?
For the treatment, they need to know the long-term goal of treatment is to prevent complication and slow down the process of having stroke, blindness, and heart disease. If we go with the strict diet, with medication, hopefully we slow down the complication. We can prolong the life of that patient.
Dr. Tran, when a patient is taking medication for diabetes, will the blood sugar level drop?
Yes, when the patient really take the medication, they still have the risk of having very low blood sugar.
And what causes?
The causes, for instance, if patient taking medication and they skip the meals and they feel sick, they don't want to eat. If they continue to take medication, the blood sugar may go low. Or the patient may have using insulin and they're so busy, they skip the meal, the blood sugar may go low. And therefore, they need to be careful about that. They need to recognize what is the symptom of the low sugar in order to deal with that in the future.
So what are the symptoms when the blood sugar?
They need to know, because suddenly they feel like cold and sweating, they feel shaking, and they feel fatigue, and they don't feel have enough strain. Or if blood sugar is really go lower, sometimes they become confused, and sometimes they can have some kind of small convulsion. And lastly, when they are alone and nobody around, they may go to coma. That's why people may die from that. So be careful. Just remember these symptoms. And when you have these symptoms, you need to check your sugar, or you have to carry some sugar cane with you, sugar tablets, or some candies, or drink orange juice to deal with that right away before you go to the second phase. You confuse, you cannot recognize people around.
Dr. Tran, would you please talk about diet of a diabetes patient? What are the important things that they need to remember to apply daily?
In treatment, the most important, I think, is the most difficult one is diet. Because we have so many food, and the food is available all the time. Therefore, the diet is so important. And throughout so many decades, and the scientists come up with different kind of thing about the diet. For instance, about the concept about carbohydrate and how to calculate calories, and also most recently glycemic index. So these are all the things that we need to know about the food, so we can select the good one to use when you have diabetes.
So would you please talk about carbohydrate? You just mentioned carbohydrate in the diet.
Any kind of food we have carbohydrate. For instance, table sugar. Fruits are any used with the carbohydrate in there. Rice, powder, cake, noodle, candy, chocolate, soft drink, milk, everything is have the carbohydrate. The very important, because carbohydrate is the source of energy. Without carbohydrate, we cannot function well, because the body needs some kind of energy. And the carbohydrate will burn to provide the energy for the body. Therefore, we need to know exactly what the carbohydrates mean. For instance, in the list of the food you see on the screen, you can see half cup of corn usually have 15 grams of carbohydrate, equal to 80 calories. The bagel, pancake, about 15 grams, and one banana, also 15 grams of carbohydrate, or small orange also contain about 15 grams of carbohydrate. So you need to learn that, and read the label on the food that you buy in order to recognize which one have high in carbohydrate. Because right now on most of the labels, the food have some content of carbohydrate and fat also in there.
Dr. Tran, would you please explain more about how to calculate the calorie in the food?
The way we calculate calorie like this: 1 gram of carbohydrate give 4 calories. Alternative kilocalorie, but to be simplified on calorie, 1 gram protein give 4 calories. So protein and carbohydrate equal in terms of calorie, and the fat have more calorie, 8 calories per gram. Now, what that means? For instance, if you look at the list, you can see like 1 banana maybe have 80 calories. 1 bar of chocolate about over 200 calories. A cup of rice, usually we eat about 350 calories. If the body need only 1800 calories, you allow to eat only 1 or 2 bowl of rice. Besides that, you eat meat, protein, and different food. So therefore, that's the way they calculate calorie, to allow a person limit themselves in terms of calorie, not go beyond what the body need. 1 Big Mac maybe 50 calories, and 1 McDonald's coffee espresso is about 200 and 400 calories. Now, how we calculate calorie? How do we know how much calorie that people need? Basically, it depends on the level of activity. If the person really is inactive person, they need only the amount by calculation, 10 calories multiplied by body weight in pounds. For instance, if the person about 150 pounds, work at the secretary in the office, a day they need only 10 multiplied by 150, so they need about 1,500 calories a day. If they go beyond that, either they get fat, they get more weight gain, and the sugar will increasing. Now, for a person very active, they need maybe about 18 calories multiplied by body weight. For instance, for people regular, we can use like 18 multiplied by 150 or so. You can have the number of calories. It depends very much on the level of activities, and the person needs to learn to do that in order to get enough calories, not really getting weight or increase the blood sugar.
Would you please talk about the glycemic index? What is glycemic index, and how can the glycemic index help in the diet of a diabetes patient?
The glycemic is a new concept because after we use calories and carbohydrate, really sometimes not able to apply to the patient and not really very effective as well. So the scientists come up with ideas is right now they're testing each kind of item of food. For instance, for rice, they need some volunteer and they give the rice for people to eat, and they measure different hour the level of sugar, glucose in the blood. So they come up with what they call glycemic index of that food. For instance, if you see on the screen, the jasmine, the white rice, is usually 1/3 of the bowl is 109 glycemic index, compared with brown rice, the same amount, only about 40 to 60 glycemic index. Bagel is about half, usually 72. Compared with the croissant, it's about 67. So this is the way we look at that. Now, if we look at on the fruit, the watermelon is the top on the glycemic index because the glycemic index is 76. Second is cantaloupe is 68. Compared with the last one, the grapefruit is about 28. And the pear, on the Asian pears, is about 38. So people use that and select the food that they want to eat and limit the amount of high glycemic index food.
Dr. Tran, when does a patient need to take medication?
The diet exercise is a bit easy to talk, but it's difficult to do. And medication is the answers for most of the cases. And right now we have different varieties of medication a person can use. But mostly in principle, the medication we use right now is number one to stimulate the insulin, because the insulin is the key. So we have a group of glucocorticoid to working on that to release more insulin. And the second group is called act on the liver to reduce the release of the glucose from the liver, called metformin. Metformin also introduce the glucose to the level against the resistance as well. So therefore, metformin is still the most commonly used now in the market. The medication to reduce the absorption called acapose, and then the medication to help with the resistance called TCD. The name is Actus. And most recently, we have a new group of incretin related, meaning the medication to improve the incretin level. So the incretin can increase the insulin level. So we have the group of new medications, Januvia, Trishenta, Onglyza, and these are basically all the medication we use right now for diabetes. But the physician, the patient can choose, depending on the side effect. They can combine 2 or can combine 3 of the medication in order to control the blood sugar on top of the exercise and diet.
When does a patient need to use the inject medication, insulin? Are these injection medications only used for patients have severe condition of diabetes? And are there any other inject medication?
People still believe that if they get worse, this means the condition is get worse, then the physician have to decide to use the insulin. But remember, insulin is very close to the body because they make the insulin very similar to insulin relief from the pancreas. Most of the patients with type 1, they need insulin for the rest of their life. They always have injection. The good thing is because the insulin is so close to the body, so therefore they don't really develop much complication. Now, the fact of reality is if the patient try different oral medication, if it doesn't work, then they have to take some kind of insulin. We have insulin and also non-insulin medication. Insulin, briefly, we can go through. We have very fast acting, working in about 15 minutes. Short acting, working about 1 or 2 hours. Intermediate acting means it lasts about 12 hours. And then long acting means 24 hours, like Lantus and Levemir. Mostly in the market right now, we use the pre-mixed insulin. That means we combine the short and intermediate acting in order to cover the body for at least 12 hours. Or if the people they don't want to get injection twice a day or 3 times a day, they have to use 24 hours. We have a group of medication. It's not insulin that relate to the incretin. They call incretin mimetic, like Beata and Glyza. And lastly, a new medication is Bydureon, a GLP receptor agonist. They just also indirectly increase the amount of insulin in the body. So it's just once a week. So that's the newest one and open the new era for the patient to try to use it if they don't want to get injection every day.
Dr. Tran, what are the important points or important things that a patient while on the injection medication need to remember? Are these injection medications have dangerous side effects, sir?
The injections long-term also has some side effects, but the most important is if the people they skip meals and sometimes they go to very low blood sugar and they develop symptoms related to that. Called hypoglycemia. It's very important to remember because when that happens, people may feel shaky, cold, and clammy, and sweating. Very important is if they are alone, sometimes they become confused and they may lose consciousness. They go to coma or develop convulsion. So these are very dangerous side effects, not just the insulin, but the treatment in general, because when people take medication, they skip meals and they exercise too much or they give a lot of insulin, they may go through these severe complications they need to be aware of.
Dr. Tran, how often does a patient with diabetes need to follow up with the doctor? And when he or she need to have eye exam and the kidney exam?
Yeah, very important because it's the function of the physician to remind the patient they need to follow up blood tests every 6 months, and not just for the sugar, but it's for the cholesterol, for other kidney function and the liver function as well. Now, they need to follow up the hemoglobin A1C every 6 months because it's so important. Hemoglobin A1C is really the key to know whether the blood sugar is really controlled for the last 3 months. If you can see on the screen, you can see how the hemoglobin A1C correlate with the blood sugar. For instance, if hemoglobin is less than 5.6, that means it's good, it's normal. But if for 7, usually the levels of the blood sugar average is about over 180. If the hemoglobin over 8, then people may go up to 200 most of the time. So the physician will look at that, and the patient also look at these numbers to know exactly what's the progress of the treatment for them. Now, they need to follow up urine every 6 months as well. They have their eye exam every year. They have the food exam regularly, and they also need dental exam in 6 months. People with diabetes usually have very low resistance to infection, and they can develop bacterial infection, viral infection, and yeast infection everywhere. They need to really be careful about that because they may cause problem. People may die from infection because they don't have the defense system like normal people to deal with that.
Dr. Tran, before we go, besides regular blood tests and eye exam, what are other important things that a diabetes patient needs to remember?
They need to remember if something happened to them, people know that they have diabetes. So they need to wear some special medical identification. The bracelets and saying that they have diabetes, or the wallet, they may have something related to that, or the list of medication they're taking. So in case of emergency, and rescue team may know this patient may have diabetes, and they may check for blood sugar. If really blood sugars go low, they just give some sugar, patient may survive. This is very important. If they don't have these things, they can get some kind of med alert. They can wear on the neck. And just in case it happens, they can press the button to notify the rescue team.
Thank you, Dr. Tran. That is all the time we have for Medical News Show today. Thank you for joining us.
Thank you for watching our show today. And again, thank you.
Welcome, sir. That was Dr. Sang Tran, who just shared with us the information on diabetes and other detailed information that we need to remember as a patient. We hope the information that Dr. Sang Tran provided to us today has shed more light on diabetes and to help us to prevent the serious condition of this dangerous disease. That is all the time we have for our Medical News Show today. Thank you for joining us. We'll see you next time on the Medical News.